This is how black people get killed. When you send them home and they don't know how to fight for themselves.
Before dying of COVID-19, an Indianapolis doctor claimed that she was mistreated and delayed proper care at a hospital in Carmel because of her race. Dr. Susan Moore detailed her experience on social media. Now IU Health's president and CEO is calling for an external review of the case. Dennis Murphy says that he is confident in IU Health North's medical team, and he does not believe that there was any failure in the technical aspects of Dr. Moore's care. But he goes on to say, I am concerned, however, that we may not have shown the level of compassion and respect we strive for in understanding what matters most to patients. I am worried that our care team did not have the time due to the burden of this pandemic to hear and understand patient concerns and questions. News 8's Demi Johnson is live for us in the newsroom tonight. And Demi, Dr. Moore documented a timeline of her treatment.
Yeah, in a 7-minute video, Moore describes all the different ways she tried to convince her doctor to give her medication. She says she had severe neck pain and trouble breathing. Moore says the doctor who was caring for her finally agreed to a CT scan, which she says showed what she had been trying to explain all along.
I was in so much pain from my neck. My neck hurt so bad. I was crushed. He made me feel like I was a drug addict. And he knew I was a physician. I don't take narcotics. I was hurting.
In the video, Moore also says IU Health North was trying to send her home too early. In her written updates, she says after being discharged, she was back in the hospital just 12 hours later. This time, she was at Ascension St. Vincent and said her care was much better. We reached out to IU Health North for comment earlier, but because of privacy, they were only able to say IU North respects and upholds patient privacy and cannot comment on a specific patient, their medical history, or conditions. As an organization committed to equity and reducing racial disparities in healthcare, we take accusations of discrimination very seriously and investigate every allegation. Treatment options are often agreed upon and reviewed by medical experts from a variety of specialties, and we stand by the commitment and expertise of our caregivers and the quality of care delivered to our patients every day. Dr. Alicia Sanders started a GoFundMe for Moore's family. She tells us her purpose was to ensure their immediate needs like food, shelter, and bills were met. At last check, the GoFundMe had reached $121,000. The page says Moore leaves behind a 19-year-old son and her parents, who both have dementia. It also says she was their sole provider and breaks down how the money raised will be spent. As for what's next, IU Health's president and CEO Dennis Murphy says the external review will be done by a panel of healthcare and diversity experts. He says they will conduct a thorough medical review of Dr. Moore's case to address any potential treatment bias. You can read Murphy's full statement online at wishtv.com. In the newsroom, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.